Alrighty, so welcome back to another episode of Paramedic Zach, where we're going to be going over another 10 flashcards to help you get ready for your paramedic exam or other applicable test. I do promise that I'll be getting back into the in-depth reviews for the previous flashcards we have gone over in other episodes, but for now I'm just focused on getting out as many of these flashcards as possible. So without further ado, my name is Zach and this is Paramedic Zach. Alright, so if you made it this far, congratulations. We are now into the triple digits of these flashcards, and we're going to start off with question 101. The Duggan formula for dopamine is blank. So the Duggan formula is a quick and effective way of calculating your drip rates for your dopamine infusions when using 400 milligrams in a 250 cc bag of normal saline. In order to use the Duggan formula, you need to know the patient's weight in pounds and then cross off your third digit. For example, if you have a patient that is 183 pounds, you cross off the third digit and you're left with 18 drops per minute. Moving on to question 102. What is the difference between type 1 and type 2 diabetes? The answer to this question lies in how insulin is used and produced in the body. With type 1 diabetes, you have the destruction of insulin-producing beta cells in the islet of Langerhans. Essentially, in this case, the pancreas is not producing enough insulin. With type 2 diabetes, aka acquired insulin resistance, insulin is not effective at the site, i.e. the site being the cell. So the cell is not able to utilize the insulin in order to let the glucose in. So with type 1 diabetes, we don't have enough insulin being produced, and with type 2 diabetes, the insulin being produced is unable to be used. Moving on to question 103. In treating patients with unstable atrial fibrillation who also have congestive heart failure, blank is the medication preferred. Alright, so after a little bit of research, it seems that the preferred medication used when treating AFib with RVR in patients that also have congestive heart failure is going to be amiodarone at a dose of 150 milligrams over the period of 10 minutes. Moving on to question 104. What is your adult epinephrine dose for cardiac arrest? So for cardiac arrest, whether or not you're following the PEA asystole algorithm or the VTAC VFib algorithm, you're still going to be using 1 milligram of a 1 in 10,000 concentration dose of epinephrine every 3 to 5 minutes. Moving on to question 105. A coronary artery spasm leading to chest pain or pressure, usually at rest or while sleeping, is known as blank. So this is going to be one of your STEMI mimickers. It's known as Prinzmetal's angina, and it can occur while at rest or while sleeping. It doesn't have anything to do with typical angina or coronary artery disease, but rather is a spasming of the coronary arteries. This can cause chest pain and chest pressure. Question 106. Repolarization of the ventricles is depicted as the blank on an ECG. So on an ECG, the repolarization of the ventricles is going to be your T wave. Moving on to question 107. What is your pediatric fluid therapy dose? So your fluid therapy dose for your pediatric patients is going to be weight-based at a dose of 20 milliliters per kilogram. I'm pretty sure in a lot of systems this number changes to 10 milliliters per kilogram if it's post-ROSC. Question 108. Blank blank has a distinct rotten egg smell and is a highly effective gas used in suicide. It's very, very dangerous to anybody nearby. Hint: HS. So the hint here is the abbreviation for the gas that is very deadly if you come in contact with it, known as hydrogen sulfide. Question 109. During the blank blank blank, cardiac cells that have fully repolarized can depolarize, while cells that have not fully repolarized cannot depolarize. So this period is known as the relative refractory period. And the reason that it's important is that during this period, life-threatening dysrhythmias can occur. This is known as your R on T phenomenon. And lastly, we have question 110. The blank blank illustrates the relationship between the partial pressure of oxygen dissolved in arterial blood and the saturation of hemoglobin with oxygen. Alright, so this is one that I always had a hard time retaining. It's known as the oxyhemoglobin dissociation curve. Thank you guys for joining. I hope this helped you, and if it did, please do me a huge favor. Give me a like, and if you want to continue to get these videos to help you pass your paramedic exam, make sure you subscribe, and you'll get notifications whenever a new video comes out. So, until that time, take care.